Hi everyone, welcome back to ilovepharmacology. In this session, let us learn about the hypolipidemic drugs. So hypolipidemic drugs are the one which reduces the cholesterol level, or as the name itself suggests that hypo means low lipidemic. So these drugs will going to lower the lipid levels in the body. So where they can be used, they are used to treat the dyslipidemias where there is a variation in the lipid levels in the body. So there are two types of lipids in the body, cholesterol and the triglycerides. So cholesterol increase in the body can increase the risk of MI and stroke, whereas triglyceride will increase the risk of acute pancreatitis. So the maximum reduction in the LDL cholesterol is achieved by statins. Triglycerides will be maximum reduced by the fibrates. So maximum increase in the HDL, so-called good cholesterol, will be increased by niacin, and these are the classifications of hypolipidemic drugs, that is statins, resins, that is a bile acid sequestrant, and the fibrates and the niacin. So statin is a drug of choice for hypercholesterolemia. Resins are the drug of choice of hypolipidemic drugs in pregnancy. Fibrates are the drug of choice of hypolipidemic drugs in case of hypertriglyceridemia, and niacin is a drug of choice to reduce the lipoprotein A. Next, moving on to the statins. So statins are basically helpful in the reduction of the cholesterol in the body. So cholesterol synthesis requires HMG-CoA, which will be converted into mevalonate with the help of HMG-CoA reductase enzyme, which is a rate limiting step. The statins will going to inhibit these rate limiting step, that is they inhibit the HMG-CoA reductase competitively, thereby there is no synthesis of mevalonate from HMG-CoA. Further, there is a reduction of the cholesterol synthesis in the liver. So additionally, liver also requires a cholesterol. So when there is a need of cholesterol for the liver will going to increase the expression of LDL receptors on the liver, and these LDL receptors will going to attract the cholesterol in the blood. So the blood cholesterol will be transported into liver for the cholesterol synthesis. Thereby, what happens to the cholesterol levels in the blood? The blood levels of the cholesterol will reduce because of the shift of cholesterol into the liver with the help of increased LDL receptors. So basically, there is a reduction in the de novo cholesterol synthesis in the liver, which further increases LDL receptor expression, which will going to help in removing the cholesterol from the blood. Additionally, the statins has got pleiotropic effect. That means it has got additional anti-atherosclerotic effect, as well as it reduces the uric acid levels in the body. So statins are useful in the individuals who are having dyslipidemia associated with gout. And when we talk about the statins, all these drugs will end with the statins. So we have a rosuvastatin, atorvastatin, which are the longer acting statins. Among this, the rosuvastatin is the longest acting drug and most effective statins, whereas lovastatin and simvastatin are the prodrugs which needs the CYP3A4 activity to get converted into the active form. Whereas pitavastatin is the most potent drug which requires a lesser dose to produce the statin effect. And these statins are metabolized by CYP3A4. That's why they're involved with multiple drug interactions. The exception for drug interaction is rosuvastatin is not metabolized by CYP, and even the pravastatin is not metabolized by CYP. The fluvastatin is metabolized by CYP2C9. So next, let us see the indications of statin. So statin is a drug of choice for hypercholesterolemia. It can be hypercholesterolemia associated with nephrotic syndrome, metabolic syndrome, or drug-induced hypercholesterolemia due to loop diuretics, thiazide diuretics, and the beta blocker. And also they are the drug of choice for hypercholesterolemia associated with alcohol. The most common and unique side effect of statin is myopathy, and also it can cause hepatotoxicity. Myopathy is a unique side effect. It can cause muscle damage that can lead to rhabdomyolysis, which can be reflected in the blood by elevated CPK, creatinine phosphokinase, and there can be myoglobinuria, muscles present in the blood, and also color urine. All these side effects are much more commonly seen in females when compared to males. And the statins are contraindicated in during the pregnancy as well as children who are less than 12 years of age. So next, coming to the resins. So resins are also called as bile acid sequestrant. So what is the mechanism of action? The resins will going to bind to the bile acid in the GIT, thereby it inhibits the reabsorption of the bile from the GIT into the liver. So the less amount of bile is present in the liver, thereby again since liver requires cholesterol, it will increase the expression of LDL receptors on the liver, which will going to reduce the LDL cholesterol. How? Again, it will going to remove the LDL cholesterol from the body. And as you know, this is a similar mechanism which we saw in case of the statins. So if anybody wants to know the mechanism, please go back to the statins and you'll get the answer. So all this drug of resins will start with chol. The examples are cholestyramine, cholestyramine, and cholesevelam. And these are the drug of choice in case of pregnancy associated with hypercholesterolemia. And, and it also has got additional mechanism similar to that of the statin, that is, resins has got anti-atherosclerotic as well as it reduces the uric acid levels in the body. So the statins and resins both can be used in individuals who are having a high cholesterol associated with gout conditions. So the side effect of resin is they cause malabsorption of fat soluble vitamins, and it reduces the absorption of some of the drugs like digoxin, propranolol, and thyroxine. Next, moving on to the fibrates. So fibrates will bind to the PPAR alpha receptor, which is a peroxisomal proliferator activating receptor agonist. Thereby, once the PPAR alpha is activated, which is present inside the endothelial cells, so this will going to increase the activity of the lipoprotein lipase enzyme, which is present in the endothelial cells, which will going to remove the triglycerides. So fibrates are used to remove the triglycerides. How to remember fibrates? It's T for triglyceride. So all these drugs will end with fibrates like clofibrate, fenofibrate, benzafibrate, and the gemfibrozil. So it is a drug of choice for hypertriglyceridemia, where the triglyceride levels are more than 500 milligram per dl. Again, the side effects associated with it has got similar side effect to that of the statins. That's why they should not be combined with the statins because of the risk of myopathy. The unique side effect of fibrate is it produces gallstone because of reduced gallbladder motility. Additionally, the clofibrate has been banned because of the risk of MI, and fenofibrate, since it has got no CYP action, so it is most commonly used because they are not involved in drug interaction. So fenofibrate, since they are not the they're not inhibiting or they have got no action on the CYP, they can be combined with the statins, as statins requires a CYP activity to get converted. Some of the products requires CYP activity. And gemfibrozil is a CYP inhibitor and it needs to be avoided in statins. Why? Since it inhibits the CYP enzyme, statins will not be metabolized and they increase the levels of the statins, which further increase the risk of myopathy. Next, moving on to the niacin, which is a vitamin which acts as a hypolipidemic agent. They're also called as nicotinic acid or vitamin B3. They act on the liver adipose tissue and they inhibit the triglyceride synthesis and they inhibit the lipoprotein A synthesis, accompanied by there is an increase in HDL levels. So these niacin is less commonly used as it requires a very high dose of 2 to 6 grams, and it is also most toxic drug as it causes flushing as a most common side effect. Apart from that, it causes hepatotoxicity, hyperuricemia, which can precipitate gout in a risky patient, or it is contraindicated in gout patient. It can increase the levels of the blood glucose level, hyperglycemia. So it can increase the risk of diabetes as well as it is contraindicated in diabetes. So what is the cause for flushing? Flushing is mainly due to the increase in the prostaglandin D2 production, which leads to vasodilation. So how to treat it? You need to inhibit the prostaglandin production. So it can be done by giving non-steroidal anti-inflammatory agents like aspirin, which reduces the PG2 by inhibiting the COX activity. There's a new drug which can block the PG D2 receptor directly. The name is laropipant. And in an individuals who are having gout associated with the hyperlipidemia, you can use statins or fibrates as it reduces the uric acid levels, and these are good for gout patients. And these are the newer hypolipidemic drugs you need to keep in mind. We have a estimib, which inhibits the NP-C1L1 transporter in the intestine, thereby it reduces cholesterol absorption in the intestine and they reduces the blood LDL levels. And we have a PCSK9 inhibitor, which is a monoclonal antibody. Example is evolocumab and alirocumab. Basically, it increases LDL receptor expression on the liver and decreases blood LDL levels, and it is very effective than the statins. There is one more silencing RNA PCSK9 inhibitor, that is the inclisiran, which decreases the PCSK9 protein levels in the liver. Apart from that, we have a bempedoic acid, which is a ATP citrate lyase inhibitor, which decreases cholesterol synthesis similar to that of statins, and that decreases LDL levels. So all this estimib, evolocumab, alirocumab, and inclisiran and bempedoic acid will decrease the LDL levels. Whereas the lomitapide, which is a MTP inhibitor, that is a microsomal triglyceride protein inhibitor, they decreases the VLDL levels. And additionally, elicosa, pentoic acid, and docosa exonic acid will reduce the VLDL levels. So omega-3 fatty acid are rich in elicosa pentanoic acid and they are rich in salmon fish. And we have a newer drug that is CETP inhibitors, that is a cholesterol ester transfer protein inhibitors, which increases the HDL levels. The examples are anacetrapib and the torcetrapib.